Good evening, everyone. I'm very happy to be here today. This is another edition of the Protect Mom and Child webinar, whereby we bring professionals from different countries of around the world, and we bring them to come and discuss certain issues relating to maternal and child health, provide robust solutions to them based on their experiences in their field. We bring doctors, nurses, public health professionals from different fields to discuss all of these issues related to maternal and child health in developing countries and all over the world. Today, on the conversation seat, we have with us Nurse Opeyemi Lawal. She's a nurse, a midwife. She is the
Yeah.
founder of Look Natal Care, where they teach women about pregnancy, about childcare, and their sexual health. She is a robust and an experienced pregnancy coach. She has experiences in volunteering, she has experiences in content creation based on maternal health and childcare. She has experiences in public speaking. She's a whole lot in one piece. Please, I'm going to be introducing right now Nurse Lawa Opeyemi. You're welcome to Protect Mom and Child Forum today. We are
Thank you
so
so
glad
much.
to have
Thank
you
you
on
so
the
much.
conversation with today.
Thank you
Thank you so
so
much for
much.
honoring, us to come and have this discussion today. So moving
Yeah,
forward, today we're going to be
yeah.
discussing the topic on the role of family planning in reducing maternal mortality in developing countries. Basically, we might have to use a case study of Nigeria since you are domiciled in Nigeria and you have robust experiences in Nigeria. So,
Yeah.
also, we're going to also be discussing the myth around family planning. We're going to be discussing challenges that are, preventing many women from accessing family planning in developing countries. Thank you so much again, Nurse Opeyemi, for coming on the conversation seat today. Welcome.
Thank you
So the
so
very
much.
first,
Thank you so
yeah, you're
much.
welcome.
Thank you. Thank
Yeah,
you for that. In fact, while you were introducing me, I'm like, is this for me? Thank you so much. Thank you. And I'm
you're
so excited
welcome.
to be here tonight. I just hope everybody's saying this. You would listen, you pick a pen, you learn one or two things from this because it's going to be exciting. So go with us. Thank you so
Are
much,
you
Yetunde.
right? You're welcome. So we're going to start this conversation with our very first question. The very first question I'm going to be asking you today, Nurse Opeyemi, is that what exactly is family planning? And what are the various options that are readily available for women to access in probably healthcare facilities in developing countries or in Nigeria?
Nigeria. All right. Thank you very much for that question. So let me start by defining family planning. I wouldn't use a bogus language because I'm sure I'm talking with both those in the health workers and those that are not health workers. So in order to avoid all the medical jargons and terminologies, I would explain it in a very short way. Family planning is just a methods, or let me say methods women use to space their children. Basically, that is the idea of family planning. When family planning came up, that was the original idea. Okay, what can we do to our mothers? How can we help our mothers to space their children? How can we help our mothers to reduce the number of children they're having? When I mean reduce, in quotes, I don't mean by killing or anything. I mean by, okay, we want to have two kids, we want to have three kids. How can we help our mother achieve this kind of thing? That was where the whole idea of family planning came in. But as time goes on, research was going on. A lot of people were doing research, nurses, doctors, people were doing research, and they came up with other benefits of family planning. Aside the fact that it helped mothers to space their children. Currently now, in fact, as we speak along, I'll tell you that there are numerous advantages of family planning. Aside the fact that women want to space their children, women would also recuperate from the stress of pregnancy and the stress of childbirth, right? And aside that, women would also take care of the other kids they have. They'll be able to have time for their family, have time for the kids, have time for the husband, have time for other activities they have to do. With that, family planning has come to help. But at the initials, it used to be that, oh, we just want to help women reduce their number of kids, or we just want to help women control the way they have kids. So basically, that is the idea of family planning. But like I said, as research go on, there has been numerous advantage to family planning.
Thank you very much, Nosope. I mean, that is very, very
Yeah.
enlightening. I can really, from what we've seen, how family planning has been able to help a lot of mothers, even in their career path, to be able to continue to, focus on their career aside just having children alone, right? So, thank you
Yeah.
very much for that. So, what are the
Yeah.
family planning options that we have that women can, readily access in probably health facilities around?
Hospitals. Okay. Currently now, the government has made readily available a lot of family planning method, and I must say it's actually free. It's only those who are not aware that don't know that family planning is free. As a woman, you can actually walk into any healthcare facility, be it healthcare facility, be it a government hospital, be it a teaching hospital. You can walk into it and say, "Oh, I want to have the family planning done." Now, there's so many family planning methods that are available. We have a monthly, the 2 months, the 3 months. We have that of 3 years, we have that of 5 years, and we have that of 10 years. So if you're a woman that you know that, okay, I want to be going every month to take injection, they will explain it to you that, okay, we have injectables, okay, you can be coming every 1 month, you can be coming every 2 months, you can be coming every 3 months, you can be coming every 5 years and every 10 months. So, and we have pills as well. So those things have been made available and subsidized by the government of Nigeria for women in order to enjoy family planning. They could actually monetize it, right? They could actually monetize it. But the government saw it as a way to help our women, as a way to reduce maternal mortality, as a way to control childbirth. That was why they made it very, very affordable. The only time you could see that family planning is expensive is, let's say, government hospitals. I'm sorry, private hospitals. It's only private hospitals that monetize it. Even in private hospitals, I'm sure there are some private hospitals that just add little amount of money, because they are private. They have to get certain instruments, they have to pay their doctors and nurses and all that. So they monetize it. But in government hospitals, in teaching hospitals, and in healthcare, you can easily walk up to them and you tell them you want so and so family planning, and you will get it. And that's it. You'll be surprised. Oh, you're only giving them 200 naira, or you are giving them 300 naira, or you are giving them 500 naira just to appreciate them, or just to get some certain instruments, let's say syringes, or let me say the instruments that they use for insertion of, let me say, for example, IUD. So stuff like that. If government have made that accessible for you to pay as low as 200 naira or 500 naira, then I do not see reason why women cannot go into an hospital to get family planning.
Thank
So
you very
those are
much,
the
Nurse.
best options that have been available as family planning methods.
Hmm. Thank you very much, Nosopeyemi. I'm really, really
Well,
excited about this explanation because normally when you ask some women, some of them will say maybe it's too expensive. I can't afford it. I
for
can,
the
when you go there, they will tell you to bring thousands of naira. No, but no, coming from a professional who works in health facility right now, we know that this family planning options are quite affordable for every.
very, very affordable, extremely affordable. I'll use that word. Yeah.
Great, great. So once since we've established the fact that the affordability and the accessibility is there right now. What do you think are the challenges that could probably stop a woman from accessing family planning options?
Okay, like I said while I was talking, I said awareness. In everything we do, awareness is very important. The truth is, I won't lie to you here today, a lot of women are unaware. They are not actually aware that family planning methods are free. They are not aware that you could walk into an hospital without having 10,000 naira, without having 5,000 naira, without having 20,000 naira, and you will get family planning done, and you'll be protected from getting pregnant or other things you have to do. So number one thing I would say is awareness. And that is where we come in. We have to do as health worker, as nurses, as doctors, as midwives, as health worker, we need to increase, we need to double our efforts. Let me use that word. We need to double our efforts and ensure that this awareness go round. Women need to know that government has made this thing available for them. It is now left for them to go there and get it. You know, there are two different things. Government has made it available. It is now left for them to go there and get it. The truth is, if they don't get it, it will be wasted at the end of the day because no one is coming to get it. Why government has made provision for this thing? They budget for it. Every government, be it Nigeria, be it outside Nigeria, they have a budget for things like this, right? So they have a budget for family planning, they have a budget for this, they have a budget for education and all those things. So it is not left for our women to go there and get it. So aside awareness, I think one thing I would say is that some women feel like family planning have certain side effects that they can't cope with. Yes, no doubt, family planning come with its own side effects. But I do tell people, when my clients and those that are taking my online classes, when they come to me and they tell me they want to go for family planning, but they are thinking about it because of the side effects. Okay, I will tell you, let's weigh your options. Now, would you prefer to go for family planning, or you prefer to keep adding kids to your 6 kids you already have? Would you prefer to go for family planning, or you would prefer to die from bleeding that you had the last time because you've had several kids, right? Would you prefer to go for family planning, or you would prefer to do so many other things that could help your life? Would you prefer to go for family planning, or you prefer to sit at home as a mother and keep having kids because you can't do anything else than having kids? You can go on with your career, you can't do any other thing than having kids. Then they'll be cold. So I asked them those questions. Okay, you want to bet, weigh your options. There is nothing good that doesn't have its side effects. But how much of these side effects is affecting you as a person, right? Therefore, as we go on, we will explain how family planning is safe and how you can choose the best family planning for yourself. Let's say, don't let me say the best, let's say the safe method that you can use as a woman. So I tell women those things. So that's one of the reasons why women don't want to take on family planning, because they feel family planning has certain effects, or they've heard from them, for their friends, their family that told them certain things about family planning, and boom, you tell them it is not my portion. I am not going to take family planning method. And I'll be like, what is happening? I'll be like, what is happening? Women that are taking family planning, are they not human beings and stuff like that? You understand? So another reason why I would think women do not want to take on family planning is the myth and misconception attached to family planning methods. The myth and misconception. Some women will say, once you get family planning, you will start adding weight, 100 kg, 200 kg. Yes, it's no lie that there are some methods of family planning that when you take them, you add certain weight, right? But it's not so outrageous like the way some people propel it. Some people will say, oh, if you have family planning, that is the end of you. You will never have kids again, which is not true. So people have family planning. Once they have the family planning method, they are done with it, maybe a month or 2 months, and they are ready to have kids. All they need to do is leave their family planning method for a period of time. And once they leave it for a period of time, of course, an hormone is being introduced into your body. Once you leave it and the hormone wears off, your body goes back to its normal self, and you can, conceive and still have your kids. But unfortunately, what they tell our women out there, once you get family planning method, you don't get to have kids again. So many things will happen to you. You start having hypertension, you start doing this, you start doing that, things like that. We're all human beings. Things like that will get people tensed up and want to lay them back and withdraw from family planning methods. So I think those are the things that women might want to consider when they don't want to accept family planning methods.
Thank you very much, Nurse Opeyemi. Look, you have spoken a lot, and you know what? Just to guide in on the few statements that you just dropped right now.
Yeah.
How
Yeah.
can women know the safest family planning option for them? And also, does nutrition play any role in the kind of family planning option a woman gets to use
Okay.
for herself?
Okay. All right. Thank you for that question. So let me start with the one that I say, what is the safest form of family planning? Like I said, there is no safest form of family planning, right? But there are family planning methods you can use considering your body, considering your medical history, considering your weight, considering your stature, and every other thing, and it will be perfectly well for your body, right? So things to consider when you want to choose a family planning method. As a laywoman, when you go to the hospital and you tell them you want to get a family planning done, they will tell you, okay, are you aware of the family planning methods we have? If you say you are aware, for them to just get a complete information, okay, can you recap? Can you tell us what you know? How did you get to know it? And after you explain, whoever the health giver is, be it the midwife, be it the nurse, be it the doctor, will tell you, okay, these are other forms of family planning methods. Okay, madam, do you have any medical history? Do you have blood pressure? Do you have hypertension? Those are the paramount questions that anybody would ask before you conclude on any form of family planning method, right? And we are not asking those questions for fun. We are asking those questions because we want to know and be able to guide you on the kind of family planning method you'll be able to choose. Let's say you're a woman that has hypertension, you're hypertensive, or you have high blood pressure, or you have diabetes and all. We won't tell you to go for a family planning method that is hormonal. Why? Reason is because hormonal family planning method could add extra hormone to your body or reduce the hormone in your body. It might distort your hormone level and making your hormonal level imbalanced in the body, thereby skyrocketing the condition you already have, right? That is the reason why we ask those questions, because we want to guide you. If in case you even choose that kind of family planning method, we'll guide you. Oh, madam, don't go for this because these are certain hormones, these are certain hormones. Because you are hypertensive, because you are diabetic, oh, it's better you go for this, it's better you go for this. So you don't add certain weight and all that. And for example, another woman that is obese, let's talk about a woman that is obese. Then she comes to the hospital and say she wants to go for injectables. So she will tell you, madam, or she wants to go for implanol. Will tell you, madam, you can't go for implanol because you are obese or you are on the high side with your weight. So if you insert this family planning method, we have had several women, we've had several feedback that this form of family planning method add weight to women. So we wouldn't want you to go on with it. Why not go for IUCD, or why not go for pills, or why not go for other methods of family planning? Right? So it is important and it is paramount that a woman discuss all these things, discuss all your medical history, discuss everything with your healthcare provider before they can now advise you on the kind of family planning method you want to go for, or before you can decide on your own that this is the kind of family planning method I want to go for. Right? So there is no completely safe form of family planning. But regarding your health conditions, regarding your weight, regarding your status, and so many other things, they are good form of family planning you can actually choose from. Right? So with the diet and with the nutrition, yes, like I said, a woman that is obese, right, we will tell her we have to control your diet. Now, from your diet, you've been obese. You can't go for a family planning method that will add extra weight to you, right? So we'll tell you, why not excuse this form of family planning method and go for this form of family planning method? Some women, they will come, they are lanky, they don't have they don't have weight. Some women are even looking for weight. They will come, nurse, what can I eat? I want to add some flesh. I want to do this. I want to do that. Those kind of women, when they come for family planning method, and we advise them, and immediately you tell them about implanol, that okay, we've heard that implanol had weight. So you say, oh, is that what I want? Is that what I want? Right? That's because they want to add some weight and all those things. So those are the things we discuss with our women before they could choose, or before we advise them towards the direction of choosing a particular family planning method.
Wow, wow, Nurse Opeyemi, you're just mind blowing, explaining all of this thing. You're just so
Yeah.
explicit, giving us the details of how to go about it. One thing I've gotten from this your particular statement is that to be able to choose the best, or let me say the most appropriate family planning method for a particular person, you must seek guidance from the healthcare provider who
Exactly,
will,
exactly,
list out
exactly.
all of the options for you that will help you to be able to make an informed decision on the particular family planning that could, that is
Method that is
suitable for the
suitable for
body
you.
system.
Exactly,
Yes,
exactly.
absolutely. Thank you so much, Nosope. So we'll just very quickly
Yeah.
now move on to the next question that I'm going to be
All
asking
right,
you. What
no problem.
what are the efforts that as a professional working in the field right now, being on the field right now, working in an healthcare facility, being a pregnancy coach for quite a number of years, and you've seen a lot of experiences, a lot of women, different issues that have come to you. What would you say are the effort that the government, the healthcare providers, probably the non-NGO sector have put in place to ensure that there is accessibility and affordability of family planning options for women in developing countries?
Okay, thank you very much for that question. Now, let me start with the government, right? While I was explaining the other time, I chipped something in with the government. We all know the thing is the government cannot do everything. Let's accept that. It begins with us. We have an effort to play as well. We have a role to play. The fact is, if we leave everything for the government, nothing will be done. That's the truth, right? Now, let's say, okay, yeah, Nigeria government, they are doing all they can, although we would appreciate more efforts. Let me say it that way. We would appreciate more efforts from them if they can do more to make accessible all this form of family planning and even more, right? But as it is now, governments have gone a long way in family planning because they distribute these family planning methods to primary health cares, government hospitals, teaching hospitals. In fact, all level of hospitals, they've distributed it both from the primary to the secondary and to the tertiary institution, right? So government have made that possible. They've distributed all this form of family planning. In fact, I will tell you that most of the private hospitals, they get their family planning equipment from government hospitals, right? Because women are not coming to government hospitals to use it. So private hospitals leverage on that and go to government hospitals to get their family planning equipment. I could tell you that, right? Then private hospitals then bring it, they monetize it a bit to their clients and all those things. So governments have done their part to make this family planning equipment and materials available. It is now left for us as an individual. It is now left for those in the health field to keep talking and talking. We have to educate. We have to come out there. We have to talk. We have to speak. We have to tell women that see this thing is available. Please go and get it. Through webinars, through interactions, through publishing, just the things we are doing now is one of the very ways we are putting our own efforts. We are doing our own part. We are contributing our own quota to women. Any woman that listens to this now, even if she's not aware before, she'll say, oh, you mean family planning method is free and accessible in healthcare? Oh, I better go there. I better go there and get my family planning done. And let's say 100 women, they watch this video and 50 goes there to do family planning. We have reduced 50 mortality. right? Because we have prevented 50 women from going into whatever they might want to go in, be it bleeding, be it delivery, be it whatever. We have prevented those 50 women through this that we've done. So government have done their part. I've moved to health workers. Health workers, we have to do their part as well. We have to keep talking. We have to contribute our quota. We have to tell these women, any woman that we are seeing that is having 5 kids, 6 kids, we have to push them to the hospital. Madam, please, we beg of you, go and get family planning method done. We know that yes, African women, we are very fertile and anything can happen. You come closer to your partner. Nobody will say you shouldn't come closer to your partner, right? You come closer to your partner, and before you know, you are pregnant. Please, why not go to the hospital and get this family planning done? In fact, the youth of nowadays, do you know that youths are getting family planning now? And you can't question them. I've done a family planning for a girl of 15 years old. I can't question her because she walked into the hospital. Yes, she's not up to 18 that I could actually say, okay, why are you coming for family planning? But it's looking at it the other way. It's none of my business. Reason is because maybe she knows herself, she's trying to prevent unwanted pregnancy. She doesn't want to go through that rough phase, and she has an option of family planning. So why not? Why not her do family planning and not have unwanted pregnancy? Why not her do family planning and not have kids that she cannot take care of? Why not her do family planning and not have abortions because she cannot take care of the pregnancy or she is not ready for the pregnancy? Right? So these things we have to keep saying it as an health worker. We have to keep talking and keep saying it and keep reinforcing it on people on the reason why they need to go for family planning, regardless of the side effects. Yes, side effects are there. Like I said, there's no good thing that doesn't have side effects. Even while we eat biscuits, too much of biscuit will give us side effects. Too much of water has side effect because you keep going to the toilet and urinating and all those things. So there is nothing that have an advantage that does not have its advantage as well. So we have to keep talking as an health worker to these women to always go for family planning. Then regarding NGOs, well, I haven't partnered with some NGOs in a period of time. Maybe if you get me big NGOs that I can work with, I don't mind. So maybe I could partner with them, we could do some other things, right? So I really don't know the impact of NGOs toward that. But I did a research that NGOs are also contributing. They are donating family planning pills, they are donating condoms, they are both the male and female condoms, and some certain family planning, they are donating it to hospitals that could not, that don't have enough of it. So I think that is the role NGOs are playing. But I feel NGO can do more. They could actually support with more. They could support with finances, even if they don't want to support with finances. They could support people that want to go out there, people like me and you, that want to do the publicity. They could support us. They could bring us on board to talk about these things, right? To talk about these things, to do public awareness for women in communities, in rural communities, especially in rural communities. Believe you me, it's only a person in urban community that has access to internet that can see what we are doing. Those in the rural community, they do not have access to these things. They don't even have money to access the internet or to have certain phones or to do certain things, right? So what of those people? How do we get to them? And unfortunately, those are the people that are even suffering more. So those kind of people, how do we get to them? How do we reach out to them? We can only get to them and reach out to them if we go and meet them. If we walk up to them, walk into their community, advise them, do public awareness, do everything we need to do. All those things, they require finances. So that is where NGO can come in. NGO could identify these people, identify people like you and I, and support us, back us up to go into these communities and do these things, distribute materials and things to these women, create awareness for these women, and tell them what is needed and what they need to do regarding family planning. So I think that's the way NGO can support. Hope I have
Look,
answered your question.
Nurse Opeyemi, you have answered more than what I even asked you. Like, it's so detailed. You know what? Based on what you just said right now, because we know that the
Yeah,
need for family planning options, it's even more in rural communities more than the urban, because they do not have access to internet like we have mentioned. Health
exactly.
workers
Exactly.
need to trek and go there physically to meet these women, to meet the men also, and speak to them physically to be able to, access these services that are also very cost effective.
Exactly.
So before we end this conversation today, you're going to speak and send message in Yoruba language at the end of this program. Yes.
Why do you want
All
me to speak
right.
in Yoruba language?
Yes,
Are you
don't worry.
giving
I'm
this
going to
video
give
to
you the
the
call
Yoruba
to action. They are
community?
going to say,
Are you giving this video to Yoruba community?
no, yes, because you just mentioned it, and which is very true. Which is very true. There are even people that would access this webinar and may not even understand the others that we are talking about. Do you understand?
Wow. Yeah, I get
Yes. All right.
it.
Thank you very. That's just on a lighter note. So before we
No
bring, we are
problem. I am
we're drawing
ready.
very
I'm
close.
ready. I'm ready. No
I
problem.
trust you. So we are drawing
Yeah.
very close to the end of this
All right.
conversation. But
All
before
right.
we go to
Thank
the end, the other time you mentioned that the government are doing a lot. They're doing a whole lot.
you. Yeah.
They are bringing all of this family planning options, all of this family planning materials to the edge facility. They are making sure they are procured and distributed all around edge facilities in the country. But you also mentioned that it would also be great if they can also do some other things. You understand that they can also, put in some more effort. Would it be very nice if you can just mention one or two effort that you think the government can also still put in more to be able to ensure that more women are able to access these family planning options? Maybe just
Okay.
one or two.
Okay. I think where the effort of the government is not showing is from we. Permit me to say we are our own problems, right? Yes, we are our own problems. Now, let's agree that the government has made available 1 million pills or 1 million implanol or 1 million what's it called, Noristerat, or 1 million Depo-Provera, or 1 million IUD to distribute to 10 local governments, right? Now, let's say at the end of the day, people in charge of those 10 local governments, it's only 5 of them that have the fear of God that will say, okay, let's distribute it. Then let's say the remaining 5 of the local government, I have to run women in this community, they are not so aware about family planning. They won't even accept it. We don't need to keep it. Okay. Why don't we supply it to private hospitals that will pay us, that will do all those things? So monitoring and evaluation is very important. I think one thing the government needs to put in place is monitoring and evaluation. If they have a team called the monitoring and evaluation team that will ensure that all these products that were made available are actually they got to the place they wanted it to get to. They get to all the local government they wanted to get to, and not just getting there, but as time goes on, maybe they do a quarterly what's it called, a quarterly evaluation, or a yearly evaluation is too far. Let's say a quarterly evaluation, have a register for them. Okay, we want to know the first quarter of the year, we want to know the women, the numbers of women who came for family planning. We want to do contact tracing. We want to know if they are using the family planning, if there is any side effects that we need to improve on, if there is anything, if there is any complaint, things like that. I bet you if the government can put that in place, I think the family planning will get more to women in the rural areas, because there is nobody that is going to direct the product to somewhere else aside from where it's supposed to go, because they know that an evaluation team is going to come at the end of the month, and they will get the contact of these women, and they will contact trace them either to their houses in the community, or they will call them, or they will reach out to them. I believe you me, these family planning methods will go well in the rural area. In the urban area, people are free to do whatever they want. People are enlightened. They don't need to force them. They are coming to the hospital willingly. But our problem is people in the rural area. And it's people in the rural area, they have more kids, they have more complications, they have more problems. They have, in fact, I don't know what to say. I think we need to focus more on the rural area. People need to listen. They need to be aware. So I think that is the way the government can improve. If they could get a monitoring and evaluation team and probably a quarterly evaluation for them to be monitoring how the family planning products are being distributed and are being assessed and used by these women, I think it will go a long way for accessibility by the women in the rural areas. Yeah.
Look, Nurse Opeyemi, what you just mentioned now, it's really, really key to accessibility of and uptake of family planning options. Because in the
Okay.
case that you just mentioned now, that the government has done a lot of work, to get funding, to procure all of these family planning materials, to send them to healthcare facilities, but at a particular point, they are not getting exactly to these places where women can access them.
Exactly.
That's a
Exactly.
huge challenge in the healthcare sector that needs to really be addressed, as she has mentioned.
Yeah.
Thank you very much for
Exactly.
pointing this out, Nurse Opeyemi. It's
You're
really, really
welcome.
key
Yeah.
to whatever we are doing in the healthcare sector.
Exactly.
So,
Yeah.
Nurse Opeyemi, I
Yes,
hope the
I'm
seat
with
is
you.
still very cold. You are not getting too hot.
Trust me, at all.
You
I am
because
extremely
you've
cold.
been dropping all of these things and it's been so enlightening. I'm just learning everything from you. I'm like, wow, this is really because initially I
Trust
used
me,
to
I'm
think one
extremely
of
cold.
the issues, one of the challenges why some women do not access family planning options is because of cost, because I used to feel
Okay.
probably it's very expensive and they don't want to
No.
go, and they feel maybe if you get there, they will say they should go and bring 10,000 naira. They'll be like, sure, what that's it, jail. Lama lowa 10,000 naira.
Exactly.
That's a family planning.
Exactly.
But not that I even know that
Exactly.
it's so cost effective as low as just 500 naira to just maybe to do some other things that is needed to be able to get the family planning, given to the to the to the
Better.
to the woman. It's really, really a great
Yeah.
one for us to really note. And awareness is really key. The fact that
Very,
ignorance is not
very
an excuse, you know. Ignorance should not be an
true.
excuse because but
I agree with you.
many mothers do not have this information and it needs to get out there. Thank you so much, Nosopeyemi. You've been really, really so
You're
awesome
welcome.
on this conversation
You're
today.
welcome.
So the very last thing I'm going to be asking you now, what do you have some call for action, some specific call for
Okay.
action that aside, because the other time you had mentioned monitoring and evaluation, which is very, very key, but maybe you have some other
Okay.
call for actions for the government, for healthcare workers themselves, for even the mothers themselves, for civil society that may want to kind of like support in one way or the other. Any call for action that you have, Nosopeyemi, over to you in just 2 minutes.
All right. Okay. Let me start with the women because all this thing boils down to women. If at the end of the day we get all these things achieved, we get the government to support, we get the NGO to do their part, we get the healthcare workers to do their part, and these women are not accepting it, then we are going back to square zero, right? We are going back to the roots. So I'm talking to women. I don't know how many women are going to listen to this and all that, but I'm speaking to women that women, believe you me, for you to prevent whatever you want to prevent, be it you want to space your children, be it you want to have a focus on your career, be it that you want to recuperate from stress of labor and pregnancy, family planning is an option for you. So why are you not taking it? Why are you not accepting it? After all, we've said that there are various methods and there are various advices. There are various questions the health worker is going to ask you for them to guide you on the form of family planning that is better for you or that is suitable for your health. So why are you not accepting this family planning method? So if at the end of the day, we don't talk to women on acceptance of the family planning, then NGO do their part, we as health workers we do our part, the government does their part, then they don't accept, then we're on square zero. So women, you need to accept family planning as a method that you feel that, oh, I think this is important. I think this will help me to sort out certain things. Okay, I think I just need 3 years to space my children. Okay, why not I just go for family planning instead of regretting that I'm doing this, regretting that I'm having kids or bleeding after I shared a post on my LinkedIn page yesterday about a friend of mine I was about to lose. In fact, I was just praying for her. In fact, I was so happy that she survived it. Right now, bleeding and having so many kids is one of the factor that could cause that uterine atony. Now, as a woman, you didn't do family planning. You are delivering year in, year out. You have 2 kids, 3 kids, 5 kids, six, seven, eight, nine, 10. It will come to a stage that your uterus can no longer contract on its own, and uterus will just be there. Once the uterus is there, blood will start coming out, and before you know, the woman will run into shock. Before you know, anything can happen, be it death or anything. So why not we accept these methods of family planning in order to prevent all these things that are preventable? Because I see that they are preventable. So if you have a method that is preventable for you, so why are you not accepting it? So this is a call to action to all women. If you feel like you want to do certain things, you don't want to have kids now, or you want to rest, or you have a lot of kids and you don't want to go further, then family planning is for you. I have relations that are using family planning methods. Like, in fact, I know of someone that have been using family planning method for the past 15 years, and she doesn't have kids. Her last kid is about 15 years old, and she's okay, she's fine. Although, yeah, she do come to me sometimes and tell me that okay, she has spotting, and I tell her, spotting is a normal thing in family plan. Those are the side effects you will see in family plan. So this is a call to action to all women. If you feel you have certain reasons, or you have certain issues, or you want to space your children, you want to do so many other things, then why not take up family planning method? Then this is also a call to action to our health workers. We need to keep on and keep on and keep on with our awareness. We can't keep quiet. We have a lot of population in Nigeria. There is no way we are going to keep quiet, because there are so many people that are still unaware of family planning methods. So when we keep quiet, of what good will it do to us? It won't do any good on us, because we can't be having a statistics. Let's use Nigeria for example. We can't be having statistics of maternal mortality year in, year out, or maternal high cases of maternal morbidity year in, year out, in which we can prevent from family planning methods. So this is a call to action for us as health workers. We need to keep talking. We won't be tired of talking. When we are tired of talking, we don't get these things done. So we'll keep talking, we'll keep reaching out to women, we'll keep advising them, we'll keep bringing out webinars, we'll keep hosting events, we'll keep talking and talking on the reason why these women need to go for family planning methods, right? Then who would I say call to action to? Maybe your neighbors, your friends. When you listen to this webinar, you can teach others. Oh, they say something about family planning. Oh, why don't we try it out? Oh, I know of a woman that have been having kids. She has like 7 kids now. Why not we advise her? Maybe she's not aware about family planning method. Why not we advise her on it? They say knowledge is power, but when you have the knowledge, don't keep it to yourself. Distribute it out to others. Let others know that you have that knowledge, right? So keep it to them. So it's a call to action to everyone. Like I said, when it comes to family planning, we all have a role to play. The health workers have a role, the women have a role, the NGOs have a role, the government have a role. In fact, your family, the neighbors, everybody has a role to play. So it's a call to action to every one of us, because we all have a role to play in the successful acceptance of family planning methods in our society, most especially Nigeria. I hope I've answered your question, Italy.
Uh, Nurse Opeyemi, you did more and you did extra. Like you did double extra. Like one thing that really, grabbed my attention is the fact that you said that family planning, awareness, and sensitization is the responsibility of everybody. the
Everyone.
responsibility of the women
Exactly.
themselves,
Everyone.
the responsibility of care workers, the responsibility of the government, the responsibility of community members, of friends, of family members, of everybody,
Exactly.
to ensure that maternal mortality is reduced in Nigeria. The fact that women continue to die due to preventable causes, causes that women should normally not die from. Maybe just by
Exactly.
taking your family planning, just by having a contraception to protect you from getting pregnant when you do not need it, from getting unwanted pregnancy that you do not want, or maybe you need to recuperate from the very long stress of childbirth, of pregnancy, of delivery, of even raising kids for 2 years. Breastfeeding is still there, exclusive breastfeeding is there, complementary feeding is
Involved.
there, and all of those are there. Do you understand? All of this stress on the body system of a woman. So,
It's
the
so
call for
easy,
action really
honestly.
strike me because it's a call for action for everybody. And
Exactly.
before we end this conversation today, I want you to send a call for action in our indigenous language, Yoruba language, to particularly men and fathers. What is their
So,
role in
in
ensuring
fact,
successful acceptance of family planning, Nosope?
I must tell you, when it comes to men and fathers, recently I've been speaking a lot on it because I saw that in our society, men are not being involved when it comes to, let's say, when it comes to, what would I say? When it comes to,
In maternal
be it
health.
pregnant, when it comes to maternal health generally, thank you very much.
Yes.
When it comes to maternal health generally, men are not being involved. That's what I've noticed over some years now. So it's so sad that men are being left out. Don't let me say men are being left out, but they are not wanting to be part of it. Meanwhile, they have to be part of it. After all, the woman did not get pregnant alone. It was a joint stuff. So since it was a joint stuff, so why not men and fathers also get involved in maternal health? Right? I've been speaking a lot on it about how fathers or men involvement will really go a long way in maternal health. So let me say this in our indigenous language, just like she said. Ẹ̀yin bàbá wa, can I start? Yetunde.
Absolutely, please just drive on.
All right. Ẹ̀yin bàbá wa, ẹ̀yin ẹ̀gbọ́n wa, ẹ̀yin àbúrò wa, ẹ̀yin ọkùnrin gangan la ní láti bá sọ̀rọ̀. Ọ̀rọ̀ tá à ń sọ̀rọ̀ lé lórí yìí tó jẹ́ family planning, ara àwọn nǹkan tó yẹ pé ó ní ìwúlò tó pọ̀ fún àwọn obìnrin wa ni. Nítorí pé àwọn obìnrin yìí wọ́n ń bímọ, àti gbé oyún fún oṣù mẹ́sàn-án kò í ṣe nǹkan tó rọrùn rárá rárá. Now tóbìnrin bá lóyún fóṣù mẹ́sàn-án, ó máa bímọ, ẹ̀jẹ̀ ara máa yọ kúrò, ẹ̀jẹ̀ ọmọ máa yọ kúrò. Lẹ́yìn ìgbà náà, ó máa fọ́mọ lọ́yàn. Gbogbo kiní yẹn pátápátá ló ní stress tó ní nínú ara. So tóbìnrin bá ṣe family planning lẹ́yìn ìgbà tó bá bímọ tán, kiní yẹn máa jẹ́ family planning yẹn máa jẹ́ kí obìnrin yẹn kó ráyè láti sinmi kó tó di pé ó lóyún, àbí kó ráyè láti tọ́jú ọmọ ẹ̀ dáadáa kó tó di pé ó lóyún. Ẹ mọ̀ pé ẹ̀yin bàbá wa, a lè deny yín, ẹ̀yin ẹ̀gbọ́n wa, a lè deny yín tẹ́ ẹ jẹ́ ọkùnrin. So if you are calling this woman, tẹ́ bá ń pe ìyàwó yín pé máa bọ̀, ó yá mo fẹ́ súnmọ́ ẹ àbí mo fẹ́ ṣe kinní kan, tí kò bá fẹ́ dá yín lò nítorí pé kò fẹ́ lóyún, ẹ máa sọ pé bóyá ó ń deny yín. So ẹ jọ̀ọ́, ẹ jẹ́ kí wọ́n lọ fún family planning. Nítorí pé tó bá lọ fún family planning, wọn ò ní disturb yín, ẹ máa ṣe nǹkan tẹ́ fẹ́ ṣe, wọn ò sì ní lóyún, wọ́n máa ráyè láti tọ́jú àwọn ọmọ ìyókù, wọ́n máa ráyè láti tọ́jú ẹ̀yin gan, wọ́n sì máa ráyè láti jẹ́ kí ara bọ́ sípò kó tó di pé wọ́n tún lóyún. Bẹ́ẹ̀ tí wọn bá ṣe family planning, wọ́n lè máa tọ́jú ọmọ lọ́wọ́ kó yẹ pé ọmọ oṣù mẹ́ta wọ́n tún máa lóyún. Tó bá lóyún, stress ló máa jẹ́ fún un, because ó ń tọ́jú ọmọ kan lọ́wọ́, kò tí ì tọ́jú ẹ̀ tán, ó tún wá lọ lóyún míì, ó ń tọ́jú oyún, ó ń tọ́jú ọmọ, wàhálà nìyẹn. Ẹ̀yin náà lè jẹ́ pé ẹ fẹ́ wàhálà fún wa. tó bá tún wá fẹ́ bímọ, ẹ̀jẹ̀ in tó fi bímọ yẹn kò tí ì dà tán àbí kò tí kúrò lára tán, stress yẹn ò tí kúrò lára tán, ó tún wá fẹ́ bí mi. In that process obìnrin lè lọ máa bleed àbí kó lọ jẹ́ pé kò ní strength fún labour àbí kóbìnrin yẹn lọ kú. So ẹ jẹ́ ká jọ sowọ́pọ̀ ká assist àwọn ìyá wa, ká assist àwọn àǹtí wa, ká assist àwọn obìnrin wa, ká sọ fún wọn wípé anytime náà lè lọ fún family planning. Family planning method yìí ṣì rèé, free ni, ọ̀fẹ́ ni, government ṣe lọ́fẹ̀ẹ́. Tẹ́ bá ti lọ sí primary health care, àbẹ́ lọ sí general hospital, àbẹ́ lọ sí government hospital, all the family planning method wọ́n ti ṣe lọ́fẹ̀ẹ́ fún wa. Intel kan máa ṣe bóyá wọ́n máa sọ fún yín kẹ́ mú 200 naira àbí 500 naira àbí 800 naira kẹ́kàn fi sí wọn ní àpò torí iṣẹ́ tí wọ́n ṣe àbí torí àwọn nǹkan tí wọ́n ń lò, àwọn tó máa fọ àwọn nǹkan tí wọ́n ń lò, torí ẹ̀ náà fi ní kẹ́ mú owó kékeré yẹn wá. So ìgbà tí àwọn government wa tó ti make it available yín pé kíní a ti ṣe ní ọ̀fẹ́ fún yín àbí a ti ṣe fún yín láti má gba owó ọkàn fún yín, so kí ló dé tẹ́ fi fa àwọn obìnrin wa sẹ́yìn, tẹ́ fi jẹ́ káwọn obìnrin wa fẹ́ lọ fún family planning? Àbí ṣé ẹ fẹ́ ká pẹ́ fún yín ni? A máa pẹ́ fún yín, ẹ̀yin náà máa pẹ́ fún wa. So therefore ẹ jọ̀ọ́ ẹ má dí àwọn obìnrin wa lọ́wọ́ pé kó má lọ fún family planning. Family planning ní ọ̀pọ̀lọpọ̀ ìwúlò fún obìnrin téèyàn bá ṣe family planning. So ẹ jọ̀ọ́ ẹ̀yin bàbá wa, ẹ̀yin uncle wa ni, ẹ̀yin ẹ̀gbọ́n wa ni lọ́kùnrin, ẹ jọ̀ọ́ ẹ̀yin gangan ni ẹ máa bá rán àwọn obìnrin wa létí. Ṣé o ti lọ fún family planning? Ṣé o ti lọ gba family plan yẹn? Jọ̀ọ́ ẹ jọ̀ọ́ ẹ bá wa rán wa létí. Ẹ sì má dí wọn lọ́wọ́ mú. Àwọn ọ̀pá yìí ni olórí ilé wípé nǹkan tí n bá sọ that is the final. Ẹ jọ̀ọ́ ẹ má dí wọn mú láti lọ fún family planning. Ẹ bá wa encourage wọn, ẹ bá wa advise wọn wípé kí wọ́n lọ fún family planning method. So this will go a long way in family planning acceptance. Ẹ ṣé gan ni. Hope I've
Now I need to be hailing you and be saying, no, so this your Yoruba is so fluent, you know. You just ẹ ṣé gan ni o, ẹ̀yin jáde wá, ẹ ti gbọ́ lẹ́nu náà sọ pé ẹ jọ̀wọ́. Ẹ̀yin nísìn la tún lè bẹ̀ pé ẹ bá wa encourage àwọn ìyàwó wa, àwọn ẹ̀gbọ́n wa tó ń jóbìnrin láti ṣe kíni, láti uptake, láti lọ gba family planning, not just for the benefits alone, but for the benefit of the kids and even the generations coming. Obìnrin tó bá wà láyé ló lè tọ́jú ọmọ, eléyìí tó bá ti kú ó ti lọ nìyí. Obìnrin tó bá wà láyé ló lè fún ọmọ lọ́mú, obìnrin tó bá wà láyé ló lè sọ wípé ẹ jẹ́ kí n ṣe oúnjẹ tí ó ní èròjà tá a dáa fún ọmọ mi. Eléyìí tó bá ti kú kò sí yẹn mọ́. So ẹ̀yin bàbá wa, àwọn government wa, our health workers will continue to thank you for what you have been doing, and they will continue to encourage you to continue to do more to ensure that we are able to reduce maternal mortality to the barest minimum in developing countries. Nosope, you have been an exciting and amazing, an eloquent, speaker, guest on this conversation today. Thank you so much, Nurse Opeyemi, for coming today for the Protect Mom and Child Forum. You are very awesome. We are supposed to have another conversation on Cysteria session. You saw my post on LinkedIn on that. We are coming to you again for a robust conversation on Cysteria session and all of those myths surrounding this particular issue also. Again, Nurse Opeyemi, thank you so much for coming to this conversation, sir. We appreciate you. We clap for you. We say the hoo, and all of the aliens. Thank you so much for what you are doing in the maternal health and child health space. You have been so amazing. Thank you so much.
We'll keep trying our best. You're welcome. Bye. You're welcome. Thank you so much for hosting. Bye.
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 Please wait, please.
Okay. I'm with you.
Yes. I just want to quickly take a very quick picture.
Okay.
Smile. All right. Thank you so much again, Nurse Opeyemi. We are so glad to have you. Thank you for all of the conversations we had today. They were so energetic. And I hope that when all
Thank
of the mothers, all of the fathers, all health
thank
providers,
you.
government, parastatals see this webinar, they will be able to take more action and draw insight from our call for action to, to continue to, put in more effort to ensure that our mothers and our fathers, accept family planning and allow them take it up. Thank you so much again, Nosope. Have a lovely, 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 lovely weekend. Bye.
Thank you. Bye.
Bye.
Bye.